please have roll call?
Estradas, Hisrich, Cotto, Mendel, Ozzie,
Here.
Vic,
Here.
6 members present and a quorum.
Thank you. Alrighty, next, approval of the minutes from January 14th, 2019.
Second.
All right. All in favor? Any opposed or abstentions? One abstention, Commissioner Kato. All right, let's move forward. Minutes are approved. Anyone here from Neighborhood Council want to make comments? None? Okay, thank you. And public comment. Item 2, 3, 4. Anybody here for have public comment? Oh. Okay, do you have have you filled out a public comment card? It would be before the item.
There's different kinds of public comment. You have opportunities now, which is the general public comment on health in the city of Los Angeles, and then after each agenda item, you'll have another opportunity to discuss that agenda item. There will be a conversation of that. There will be a conversation on which item?
This is the motion.
It'll be item number 2.
Yes.
So after item number 2, you'll have a possibility to discuss that if you'd like. Yes. Sure. So there are these little cards. Yes. Theoretically, you're supposed to fill them out, hand them to the city clerk. We'd love to have your opinions and comments.
All right.
You're welcome.
Are there any other public comment, general public comments? No? Okay.
Comment would now be closed.
Yes, public comment is closed.
General public.
General public comment is closed. Item number 1, Healthy Kids Zones, Empowering Residents to Transform Communities. Sonia Vasquez, Policy Director from Community Health Councils. Thank you and welcome.
Thank you so much. Can you hear me? Okay.
Yes.
Thank you so much for the opportunity to talk about Healthy Kid Zones. Let's see. So just really quickly, for those of you that don't know me, my name is Sonia Vasquez. I'm the Chief Program Officer for Community Health Councils. And in a nutshell, basically, we are a policy advocacy organization that works with the community to identify and inform policy recommendations or strategies to create policies and systems change that impacts the health and well-being of community members. And so today I have the opportunity to talk to you about a concept that CHC was involved in creating back in 2012 called Healthy Kid Zones. And basically what this is a concept that looks at working with residents and other stakeholders within a half-mile radius of a school to work together to identify the challenges that the community faces and to identify what the health promoting policy solutions are to those challenges. So oftentimes when initiatives or campaigns come into the community, they tend to be very top-down. Granted, there's a lot of research to identify what those issues and concerns are, but ultimately it creates this place where this is the issue that we're working on, and this is the only issue that we're working on. With this concept, it's really about working with the community for the community to identify what are the concerns that they want to address, especially when these challenges often happen. They're so interrelated. And why a half mile? Because a half mile tends to be how most people function, where they go from where they live, where they work, where they play. And why a school? Because a school, it could be considered a center of excellence. There's a lot of resources that happen at a school. There's a lot of connections that happen with a school in your community, regardless of whether you have children that go there or not. So the way this came from concept to action, so again, between 2012 to 2014, we worked with public agencies and other groups to design the Healthy Kids Zone concept in order to mitigate local issues around health disparities. The concept was adopted in the LA's general plan, the Plan for Healthy LA, which is why I wanted to come talk to you guys about this, because it is in the Plan for Healthy LA as a best practice that the city should advance. For about a year, key departments met to kind of talk about how to implement this concept. But in 2016, CHC was asked to kind of take it back, be a backbone organization, pilot test it, and come up with some best practices and guidelines for how this could be replicated, so that ultimately you would have healthy kid zone circles that, you know, go around the city, around different schools. And so today we convene a work group with community partners, public agencies, youth and residents around Fremont High School, which is where we're doing the pilot. This is basically just a understanding of the framework of how it gets implemented. I will say that this has changed as we've done this, and we realize now that while the same basic framework will probably exist as we move to a new area and a new school, it leaves room for some flexibility, because clearly the issues and the challenges that happen in a community will be different by community. But ultimately, you know, there's some set of, you know, stakeholder engagement, community assessment, data analysis, development of strategies, and then the advocating for whatever change comes out of that. And then, as always, monitoring the implementation of that. For any Healthy Kid Zones, the potential health promoting solutions will vary by the community, whatever the community decides to focus on. And it could be anything from physical activity, the food environment, public safety, health and social services, and the list goes on. These tend to be the things that come up, and in a minute I'll share with you what's bubbled up around the Fremont High School community. And then for those of you that don't know, Fremont is located in South Los Angeles. So why Fremont? For a number of reasons. Fremont was chosen because it's located in an under-resourced community. It has a lot of existing infrastructure. There's a clinic on site. There's a community garden. It's also located within or next to other large community initiatives like the Best Starts, the Slate Z, the Building Healthy Communities. And when we talked with the public agencies, Department of Planning, Department of Public Health, about, you know, doing the pilot, it was unanimous that Fremont would be the best location to test this out and see how it'll work. So throughout the last year and a half, I say, you know, we've done a number of things. So one around community engagement, really promoting the project throughout the community, strengthening partnerships with the school, as well as with other community groups that are either working on Fremont or in the community, also the local neighborhood council, and then training residents to conduct assessments and deliver outreach about the project and share their stories. So we've been able to engage. We worked with youth, and we've been able to train youth and adult residents to become HKZ ambassadors, and I'll talk a little bit about that. And have a work group of about 16 organizations and 7 active residents, although we have probably a total of 15 to 20 that actually go out and do a lot of the outreach and the assessment for us, but about 7 that come on a consistent basis. And an HKZ ambassador is anyone who lives, works, or cares about improving the health of the community within the HKZ area. In this situation, it's the Fremont area, and are committed to doing outreach and education and engagement. While funding is always a challenge, we do try to pay them just even a stipend, a gift card for a certain number of surveys they do or outreach engagement contacts they have. Oops, I lost it.
Where'd he go?
I'm always the one. This is like my third presentation in the last 2 weeks where technology has just not been my friend. All right, so let me,
Slide 10.
all right. So in terms of community assessment, we've surveyed residents in the community. Over 700 residents have been surveyed on their opinions and thoughts and perceptions around the challenges in the community. We've done a built environment assessment of almost the entire area, not quite, but basically a walking assessment where adult and youth residents walk the streets to see what was there, what did they see visually in terms of the types of resources or lack of resources, and have been organizing community meetings for residents to provide their input on the data. An event as well. You'll see the picture that's up there. That was an event we did where we made infographics of all the data, and we actually had young people go out and take pictures providing a visual representation of the data, and then participants of that event were able to just provide their thoughts about what they thought about the data, how that impacted them, and for them to actually give us possible policy solutions. And these are the things that have been bubbling up. Real easy, right? Education on the new cannabis laws. This is confusion, right? People just don't understand. They don't know what's legal, what's not legal. They don't know what their rights are. They're just really confused about the implementation of the cannabis laws. Improving street infrastructure, that's a lot around some simple, like low-hanging fruit, like the streets aren't cleaned as they're supposed to be. Dumping is happening. The alleys just aren't clean. There's not enough street signs. The bus shelters that they have, they really don't have bus shelters. They're just stops with a sign. And we had one parent that talked about the fact that they couldn't go. They had to miss their doctor's appointment because it was on that day, those days when it was really hot during the summer, and they waited for the bus, and the bus was late, and they waited, and finally it was just too hot. There was no place to sit. There was no shelter, and they had to leave, which then caused them to miss their appointment. Public safety runs the gamut on a variety of different things, just sort of community safety. The affordable housing. There's a huge homeless population in the Fremont area, and really wanting to understand what the resources and supports are for that community. And so as we talk about what the next step is, so within the Fremont community, our next step is to start having conversations with public agencies that have jurisdiction over either the geography or the issues, and begin to identify, and then other community groups that are working on those issues to begin to identify, well, what's already happening around those issues? Is there a way that we can plug the community into existing campaigns, or does it mean having to do something new? Working with the local neighborhood council, we think that's going to be a very important strategy to move a lot of especially those things that may take longer conversations, like public safety and housing. We hope to hold a community forum sometime in the next couple months where stakeholders will be able to confirm, yes, those are the issues that are most critical in our community, and prioritize possible strategies to advance. And then the HKZ members will develop a plan to advance those strategies. And at the end of this, we'll create a playbook that will allow us to then look at replication in other areas. And that is Healthy Kid Zones.
Thank you so much for your presentation. Commissioners, do you have any questions? Thank you. Commissioner Cato?
Hi, thank you for your presentation, taking the time out to come. And I was just checking on the plan for a healthy LA, and it does, talk about healthy kid zones. And says it was funded by the Center for Disease Control. Is that correct?
Well, in the development of it, in the design of it, we had a grant through a community transformation grant. Oh, actually, I'm sorry, that's not right. We had the REACH demonstration grant. That's the one that we brought people together to help design the concept.
And since then?
So right now, we do what many nonprofits do. We leverage. We do have a grant. We did have a grant from LA Care to just sort of to help with the early phases of it, and we're in conversation with them right now about getting some funding to continue through the end through of the project. And just the good fortune that the residents will come when we need them.
I have a question. Is the area around Fremont High School, is that the only Healthy Kids Zone in the city?
Right now, because we're just pilot testing it. So hopefully the goal is that there will be more. But, the conversation with the city when we, and the Department of Public Health, when we kind of took it back to pilot test it, was that we would hopefully have a conversation about how can we make this sustainable so that this would not necessarily, I guess it could be a partnership with community organizations as it should be, but how could we then work with the city to actually implement this process throughout and maybe in key parts of the city, not just South LA, but clearly that's the most important for us.
Three questions, two kind of broad about your agency. One is, what's your annual budget?
Our annual budget right now, so it's a little tricky because where right now we have a First 5 LA Best Start grant, so that sort of puts our budget on the higher end. I'd say probably we're at about $4 million right now. Most of that though is pass-through money, so that's money going into the community for those Best Start projects.
So your overall budget on an annual basis, at least in fiscal
in this
18-19,
year, yeah.
is 4.2 million?
Give or take, yeah. I don't have the exact numbers. I'd have to get back to you on that.
And some of that is given to individual other agencies or pass-throughs to who?
To the organizations that are working on the Best Start project. So are you familiar with the Best Start, for the First 5 LA Best Start project?
Yeah.
So we convene organizations that are helping to facilitate those 4 communities in Region 2, which is West Athens, Broadway, Manchester, Compton, East Compton, and Watts, Willowbrook. And so we have convening organizations that help to coordinate their meetings. And then right now the communities are deciding on projects that they want to do, and there's a pot of money that's going to fund those projects. And it varies by community what they're working on.
And how many FTEs do you have?
For my agency, we're at 15 FTEs.
And just because you currently just have one pilot project, those 15 individuals are just working on this one project?
No. I'm sorry. 15 individuals across the agency working on that pilot project. We probably have about 2 FTE working on that right now.
So you said the 4.2 million, that's on the Community Health Council, not just the kid zone.
Yeah, so Healthy Kid Zones, actually, right now, we're between grants on that, so there is no budget for that. The last budget we received from LA Care for that was $150,000. Which will be another thing we'll have to consider, like the true cost of this, because again, we leveraged and,
Sure.
we're able to make the dollar stretch.
Right.
Right.
And then a specific question about the Fremont project. You noticed in your little cartoon that one of the students has an 18-minute commute. Looking at what's healthy for kids to commute, do you have an analysis of, say, a high school like Fremont about how far kids are coming to get their education? Are they coming from 2-3 zip codes? Are they coming from all over the city of Los Angeles? Do we know that?
I don't know the exact commute time. I would say that most of the kids at Fremont do come from the area. It's not a school that has a lot of students that come from outside of the area. So most everybody is within that half-mile buffer zone, maybe a little bit, maybe 1 to 2 miles outside of that, but for the most part, they are from that community.
one would think that time is a valuable resource to adolescents and to high school students, and it'd be important to know, if we're looking at their general health, that they're not schlepping from one part of the city to another part of the city to get the education that they have. And that would go into whether they have time to exercise, to do their homework, to
Yeah.
deal with other stress as well. So it might be something you want to look at.
Yeah, I mean, ideally, so the idea, the basic concept around the Healthy Kids Zone is about trying to create a community around the school that actually promotes health and well-being, right? So that as they're coming outside of the schoolyard, that they have those opportunities, and they're not having to worry about, and you know, while half a mile may not be enough, and at some point maybe we need to think about broader than a half a mile, it really is about creating a safe space for them that they don't have to then worry about, you know, all of the things that young people end up in communities like South LA end up having to worry about in terms of violence and trash, and will they be able to get the bus, and worrying about crossing the street because there's not enough stop signs in the community, that kind of stuff.
One of the concerns I have is that of the 500,000 students in the LAUSD, 67,000 plus students are traveling long distances to go to their schools, which is a pretty significant percentage of kids that are spending a lot of their day sitting in traffic, adding to pollution, hurting their own health and also the health of the city of Los Angeles. Potentially, there might be a more efficient way of giving them a good education and better health as well.
Oh, for sure.
Thank you for your time.
Can I piggyback off of his question?
Sure, Mr. Castro.
Just to look at it from another perspective as well, and I don't know if you're going to have budgetary means, but, you know, we're trying to look at kids that are going there from the outside, but I think it'd be interesting to see how many local kids where parents are sending them away to charter schools where they do travel, you know, 3 hours to get to a, you know, better school. That talent might be within your zone,
Yeah.
but, you know, they're not being cultivated because they don't see that as a healthy school, or, you know.
Right.
So
And
that
that-
might be, if you can, you know, track that, it might be interesting to see if there's a change in the future.
Yeah, I mean, and then ultimately, I mean, that's the other thing, right? So how do you design an environment around the school that makes it more and allows the school to be more healthy, and to not have to deal with the challenges that are happening outside the school, because a lot of our schools unfortunately have to deal with that. If they didn't have to deal with those challenges, how much more productive could they be in providing good quality education to students, right? So, good point. I should look that up.
Yes.
If I may, I have a question. Have you had success or interaction with local, I noticed you mentioned markets and so on, to try to really improve the fresh fruit or fresh food availability, and maybe turn down some of the more negative things that can get sold?
Yeah, so it was definitely an issue that was right. So one, we did do some business outreach just to make sure that the local businesses knew what we were doing, and also to get their concerns and challenges as well, which mirrored a lot of what the students were saying, I mean, what the residents were saying. In terms of focusing on healthy foods, it was definitely an issue. It's just interesting, I mean, because we're an organization that does do food access work, but it wasn't one that rose up. You know, it's hard because it's so many challenges in the community. I think that it's all interrelated and all connected. So we will definitely, as we're working to address the challenges and the concerns that the community has risen up, also try to figure out how do you work on these other things while maybe didn't come up as a highlight or still important.
That wasn't perceived by the community as particularly important.
Exactly.
So-
And that's why we continue to do a pulse check, right? So the surveys told us something, the community engagements told us something, but we're going to do one more because we want to make sure that this is exact. You know, we want to make sure that we've talked to as many people as we can to ensure that we weren't one-sided and maybe only heard from some of the community when the rest of the community maybe does prioritize food access.
Conversely, was there much community interest in cutting down the sort of negative things that could be sold? Alcohol, smoking, and tobacco. Is that probably not much interest either, huh?
Yeah, well, so the cannabis stuff, and actually I failed to add this as a asterisk. So the cannabis confusion is big. The other thing that came about a lot in the conversations with residents was smoking, but not the traditional smoking, the like the e-cigarettes or the, what do they call them, Juuls or what, this new, you know,
Electronic
right.
Juul or whatever all that
Real just like like wanting to be educated and understanding those issues and challenges. And I will say that, you know, in the public safety area, we've had internal conversations and are going to want to have more conversations with the residents about this. But there's a lot of ways you can make the community safe. And so, for example, making sure more people are accessing the gardens that's at the high school, that more people have access to fresh fruits. You know what I mean? Like, it's all connected. It's just how you make those links for people. You know.
Quick question. Thank you for this. It was very helpful. Have you guys done any cost-benefit analysis between what you can do inside the school versus outside the school? And is there any priority first on those two aspects? I know you said it's all interconnected, which I agree, but have you guys looked at that at all?
We haven't looked at the cost, but it is something we want to do because clearly we want to be able to give the city a good understanding of what the cost of this would be, and why this versus some other projects. We haven't. I mean, honestly, we do figure we have to figure out how to do that. Maybe work with an economist. It's not something that's really in our wheelhouse, but any recommendations, we'd love to work with somebody on figuring that piece of it out for sure.
Commissioner Ossie?
Yes, in reference to access to healthy food, was there an assessment done around the schools, maybe during dismissal and street vending? What I tend to notice is around dismissal, there tends to be a high rate of street vending around the schools that don't always offer healthy options. And so if that was something that was identified as a challenge, were you all able to outreach to those vendors to maybe offer healthier options for the students that are dismissing from school?
Yeah, so we didn't look at street vending specifically. We did provide, as we were, you know, beginning to look at the surveying and designing the primary data collection, we did look at a lot of secondary data and noticed that just in general, food access was an issue in that community, which still surprises us a little bit that it doesn't sort of rise up. And I think it's just because those other issues are just so much of a challenge that it doesn't tend to rise up. So I would say that it's not that we're not, as an organization, we're not going to prioritize those. We just have to have a balance between what came from the community and then what else we can do and what connections we can make. So for example, we do have a lot of connections with other organizations that are working on other issues, and while they may not have been prioritized in those areas, we're going to try to figure out how to work with them, such as learn, oh my God, what's Rudy's?
I don't know what the acronym is. What it stands for.
But it's an organization that works a lot around street vending. So we thought about, in addition to sort of focusing on the issues that are important to the community, how do we then have conversations with organizations that are working on maybe other issues that could help support and strengthen the community as well. And this particular organization does a lot around street vending, so we thought to bring them in. Thank you.
Oh, Commissioner Estrada?
I had a question. It's good to hear that you're collaborating with other agencies, and I wondered if, when the community assessment was done, did you have the opportunity to collaborate with other health and human service agencies, such as maybe local clinics that are in the areas or hospitals that do community needs assessments to help you with your findings?
Yeah, so for sure, we so UMA's on the site, so we worked with them, Neighborhood Land Trust, Community Coalition, Cadre, a bunch of other organizations. One, to either provide data that they had already collected so we can leverage and share that with the community, and or two, really to work with them to identify residents. A lot of the parents that have been working with us came through a project that was happening at UMA Clinic, and were also parents on that participated at the school. And then like with Community Coalition, they had a project where they were working with youth on the campus, and so we worked with them to train their youth to go out and do survey collection for us as well.
And moving forward with the emerging issues, the findings, am I understanding this right? You need more funding to safety and
Yeah, yeah. So so again, right now, we're looking for funding. We're hoping to get an additional grant from LA Care to continue the work. And then just trying to figure out, the goal is, there's a lot that's happening, a lot of organizations that are working on issues. There's stuff happening at the county, the city level. And so like the next couple months is really about identifying what's already existing. So we're not trying to do a whole new lift, but maybe adding more light to that and making sure that the residents that are a part of the HKZ work group are also engaged in those efforts as well, So, and then we'll have to figure out if it is something that's going to take on a new lift for us and the community, then we'll have to figure out how to find funding for that. For us, it's really important that the residents get some sort of compensation for the work that they're doing as much as we can. So that for us is like the big thing, is trying to make sure that there's funding for that, for sure.
and you're working with neighborhood councils. Have you considered working with like the local chamber of commerce
Oh, that's a good one. I hadn't thought about that, but that's a good one.
and also with the city council representatives for the district?
Yeah. It's been, when we think about the challenges, I didn't put the list of challenges, but one of our biggest challenges has been really engaging or re-engaging public agencies and our local elected officials in the absence of having identified issues, right? Now that we know what the issues are, the main issues, our goal is to go back and say, okay, now these are the issues. Can we have a conversation about what your office is doing to address these things and how we can leverage those efforts to make these things a reality? Like all that infrastructure stuff, one of the biggest issues is street cleaning, and that is actually an issue that comes up every time we have a conversation in the community. And that for us is low-hanging fruit. Like, can we just get the Bureau of Sanitation to just make sure that they're cleaning the streets as they're supposed to clean the streets, and that people know how to do bulk pickup, where to call for that kind of stuff, and that the city and the Bureau is actually picking up when they're being called to pick that stuff, and that the alleyways are cleaned when they're supposed to be clean. Just things like that shouldn't really be a big lift. We're just asking for the job to be done in a more ethical, quality way.
Because that relates to the community's public's health.
Right, exactly.
Commissioner Cato?
Okay, who's your council representative?
In that area, it's it's Kern, right?
I believe
Current
so.
president.
Yeah, Kern is that area.
Do we have now to Candy, do we have a representative on the Health Commission from that district?
Council District 9?
That's 9.
9.
9?
I thought we did, but
Avila.
Yeah.
Yeah, Avila, Commissioner Avila.
So there is a health commissioner
yes.
in that district.
So
Maybe
I
you
should
could-
connect with that.
Right, connect.
Okay.
And then, which neighborhood council do you work with?
So it's Can Do, which is a bit of a, Can Do has been a bit a struggling neighborhood council, but they're really eager to figure out and working with Dunn to figure out how to really strengthen that. And they're going through some changes. They're doing a new election, or they just had a new election, or I think it's coming.
June.
Yeah, and so there is some interest in building up. They've been without a full voting body right now, but they think that by the next election they will. So there's some interest in starting to look and how can they be an integral part of the Healthy Kids Zones project and take what those major issues are and take those on as priorities for themselves as well.
If you get your stakeholders to run for those positions on the neighborhood council, it'll give a voice to what you do, basically on a monthly basis. So
That's another strategy that we've identified, sort of an underlying strategy. How do we do a better job at promoting what the neighborhood council does or can do, and how do we build up the capacity of the residents and stakeholders to participate on the board? So that's definitely something that we're starting to think about, and how do we promote that better? And actually, one of the things we're hoping to do at this town hall forum that we want to have is also every time we do something, also promote the neighborhood council so that it's interrelated.
love the fact that you're getting input locally from the whole entire community and speaking to the stakeholders that are around the school in this case. What I would ask you to look at is when you're collecting data, to give the data to both the city council member as well as to the LAUSD department that is in charge of Fremont, whatever division is. For example, car accidents, kids who are hit, near misses, because clearly one of the biggest causes of health impact is accidents around kids. And we know it has an impact in the city of Los Angeles. And I don't think that we're really collecting it. And the DOT has done a really poor job of getting that data. So as long as you're out there talking, ask the stakeholders and the community, especially at your public forums, have there been accidents that are not being reported? Does the principal know about that? Does the vice president principal know about it? And are there near misses as well? Sometimes the community knows more about it than the city government does.
Yeah, no, perfect, good idea.
So, Commissioner Austin.
So in reference to the identified issue of illegal dumping and trash, one opportunity to engage closer with your council member that I would recommend is 311.
Yeah.
Reporting to 311 or the app seems to be pretty successful in the district that I work closely with. And they really do a great job of promoting that in the community, and it gives the community an opportunity to sort of take ownership of that process. They're able to actually take pictures and send it directly to the My 311 app. And so working in that particular area, there's a way to track maybe the uptick of reports, and then maybe you could measure if there's a marked improvement in either trash pickup or the dumping and things that are occurring in the community.
Perfect, thank you. These are all great strategies. I appreciate it.
Okay, thank you so much for being here. So my question to you is, how can the commission support you? It sounds like one way is to connect you to the commissioner that is in Council District 9. Is there anything else that the Health Commission can support you?
Well, I mean, I hadn't realized you guys did the Health Commission report. I actually saw it I haven't read it all, so I'm going to read it. And I saw that there was some recommendations. So I'm actually going to go through that and see if there might be some synergy with what you guys have recommended with some of the things that are coming up in the community. Because again, this is about trying to, everybody's saying the same things, but sometimes we don't know that, right? And so I think I would love to then have a conversation with you later once we've sort of done that and see where there's some synergy between that, and come back and share that with you all.
Perfect. Thank you.
All right. And also helping to remind the city that this is actually part of the plan for Healthy LA, and that hopefully this will actually be a city project, not just CHC's project.
Perfect. Thank you so much.
Thank you.
Hey, thank you for coming.
Okay. Let's move along to item number 2. Discussion and/or action relative to City Council adopted motion requesting the Los Angeles City Health Commission, along with the Los Angeles County Public Health Department, to report on.
Madam President, I know it started, did you do public comment for one? Or comment on number 1?
So we can go back.
You need to, if there is a comment card for 1, it needs to be done.
Yes, there is. So I should take public comment on item 1?
On item 1, yeah, if there was.
Okay, because it wasn't at the time, but, okay. Okay, we have one for item number 1. I can't read this. Does this say Pepita?
Talking about the 9th Council District, what a shame it is their councilman Curran Price is stealing everything he can from the 9th District. He gave $2 million out of the office furniture account to fill get immigration forms. Did you know that,
Madam
our
President,
friend?
Stay on
speaker's off
topic,
topic.
thank you.
You are on the topic of the 9th Council District. If you're not talking about that shit, you're talking about current price. And I'm telling you, your elected criminal representative is the problem for these people trying to get shit done in the 9th District. You're not blaming can do, can't do. Why? Because of Gordon Price and his wife, Del Richardson Price. Because they're stealing
Madam
everything.
Speaker,
They are
Madam
stealing
President, the
money
speaker's
from
still
the
off
9th
topic.
District.
Please stay on topic, thank you.
But they are, ma'am, even though I know you're black and you're trying to protect this crook, but you have to understand that these people, mostly Latinos, cannot get services and health benefits because of Candu being restricted, because of current price and his traders. So that's why we want you to recognize the fact that we understand the ghetto. We hear this person here who drove me,
Thank you.
and me, Papita Pig, the advocate for all of Los Angeles. While you're sitting there, we are fighting typhus. I have to risk my health sitting in this fucking room, maybe getting bitten by ticks with typhus, while you sit there and talk about stupid shit instead of this health crisis. What are you going to do about the typhus? We are all going to get typhus and die. Fuck you and fuck the city.
Thank you. Item number 2. Discussion and/or action relative to City Council adopted motion requesting the Los Angeles City Health Commission, along with the Los Angeles County Public Health Department, to report on 1. The status of the health study updates mandated by the settlement agreement between South Coast Air Quality Management District and Southern California Gas Company, and 2. The levels of styrene, ethylbenzene, uranium, and lithium in the area surrounding the Aliso Canyon gas leak as brought forth by the independent physician report conducted by Dr. Jeffrey Nordell. And the council file number is here, number 151380S9. Okay, we have quite a few public comment cards here for item 2. You want to discuss first? Okay, everyone, so I was contacted by, I believe, Council District 6 in regards to this motion that was put forth about a year ago. And at the time, we were low on commissioners. We've always been sort of working to get our commissioners, the seats filled. So unfortunately, it slipped through the radar. But I'm bringing this forward to you because we need to work with the health department to move this forward. So right now, I'm really interested in hearing from the rest of you thoughts about how we can proceed on this particular motion. I'm trying to pull it up. Any thoughts?
So if I can, Madam President, the city council has asked us to comment on a motion that has been presented to them, or am I misunderstanding the?
They are asking the commission to work with the County Department of Public Health to report on the status of a health study that was mandated by a settlement agreement between two entities, the South Coast Air Quality Management District and the Southern California Gas Company. So that's the first one, that we're supposed to work with the county department to say, hey, what's going on with this report?
So I can only speak for myself, but I imagine all the other commissioners, we haven't been given that report.
Right.
So it'd be inappropriate for us to make comments on a report that we haven't read. It's also interesting that if the city council had wanted us to work with the county, that we weren't sent that report. So I would ask, if we may, the city clerk, to see if we can all be given the report that we're supposed to be commenting and acting upon I think that would be a
Perfect.
wiser
Yes.
way for us to address this.
But are they stating that they want us to get the report, or is the report available to City Council now?
Request the Los Angeles City Health Commission with the assistance of the Health Department to report on the status of the health study.
So the health study has not been completed. They want our help in trying to push that along.
It sounds like it could be either that it's complete, we need to follow up, or that, again, it's, as you said, it's not complete. So I think right now, just this conversation is sort of helping me, figure out like, okay, well, we need to outline some steps, so.
So we need to know which public health officer has been, or which division of the city, county Department of Public Health has been addressed and is addressing this. Two is the independent physician report that was made available, or to be made available to us. Thirdly, we probably should know what progress has been made from the LA County in evaluating and investigating claims in the report. And then I'm assuming there's a public health representative in the supervisorial district. So the legislative aide who's in charge of health for that supervisor probably has some information that would be beneficial to us. If they can send it to us in a memo or email, that'd be nice. And if not, if they'd be willing to come to our commission, it would be probably prudent to have them present us.
Perfect. Okay. Other thoughts? Okay. I think my ask is there anyone here, one other person that can assist with this? Because it sounds like there's quite a bit here to work through. Is there anyone that can help? Just one person. You can split it up. Okay, thank you, thank you. Okay. Okay, so now let's go to public comment. If there are any other questions or comments? Okay, perfect. Okay, Dr. Jeffrey Nordella?
He's the report guy. Thank you for coming.
You're very welcome. How can I help you?
You have a public comment card? Did you have a statement, a 2-minute statement?
I'm here because I saw as of last night my name was being used, and I thought I would show up to see if I could address any issues you might have with the health study I performed.
Perfect. Do you have any information that you could help steer us in the right direction towards figuring out this, the motion, perhaps?
And can you be specific on what the motion is again, please?
The motion was really that the city council asked us to address this issue and send it back to them and kind of partner with the county, which is really priority is to handle and address this. So the City Health Commission has a peripheral role in going through certain data and going and sending it back up to the City Council. So we're kind of like a gatekeeper, though we don't need to be or have to be. So theoretically, the primary legislative body to handle issues of public health is really the County of Los Angeles.
Right.
However, if it is also in the City of Los Angeles, then the City Council has responsibility, and hence we, as this commission, have a fiduciary responsibility to try to assist them in doing that in any way that we can. So that, in a nutshell, kind of narrows it down. Seeing that you did an independent report, the 3 questions I would have for you would be, One, obviously you're motivated to address the issue of the problem that is in that community. Was that you were brought in and hired, and if so, by whom? Second is, when your report was done, who did you send it to, and and thirdly, would you make it available to the City Council as well as to this commission? Thank you.
You're welcome. So there's a lot to address there, and obviously I'm not prepared to give the PowerPoint, but the PowerPoint was given on October 14th of 2017. It's quite voluminous, and it entailed a study that started in January of 2016 and is continuing on today. It's in its fourth or fifth phase. The first phase was clinical trials, or just collecting clinical symptomatology. Second phase was the same. Third phase was the toxicology screens that you're alluding to, which showed significant levels of uranium, of lithium in the hair samples, and a statistically significant level of styrene and ethylbenzene in the population in the North San Fernando Valley. I'm trying to stay very general and broad with you. I initiated then in August 1st of 2018 a medical surveillance study, which is recommended from the literature, to look at all of the indices of the CBCs. And you have to go back really quick and lay a little foundation, is that what these poor people were exposed to, which was 16 weeks of over 100,000 metric tons of polytoxins, not just one toxin. Poly, meaning, let's start at the top, benzene, toluene, ethylene, xylenes, heavy metals, crude oil, particulate matter, so it affects every organ system of the body. Is that all I got?
Can we give an additional time?
Madam President, you have discretion.
You can continue.
So when we looked at this, benzene was the worst and admitted by the Department of Public Health because of its history of its carcinogenic studies that dates back 50 years. So when we implemented the CBC program, we were looking at the indices of the CBC from the stem cell on down, from the white cells, red cells, hemoglobin, hematocrits, platelet volumes, things of this nature, and the studies are just starting to come in, the statistics are just starting to come out of that. But prior to that, again, symptomatology was there stating that these people are sick, okay, in two phases, and then followed with the hair and the urine VOC study. Now, I heard you mention lithium, so lithium was there. Lithium was very interesting. Lithium is a drug regulated by the FDA at a higher dose, but when it was found in the hair sample, we used controls, and the controls were 6 independent, okay, around the area of the Los Angeles Department of Public Health, which was addressed and given over to them, that they had a large amount of lithium in the hair samples of LADWP subscribers. Those 6 different controls were all non-detectable and were not related to any one. So when this was brought up, I hate to say, it was swept under the carpet. I met with Denise Jones at a town hall. They said they would be more than happy to work together. Never heard from her again. And these issues have not been addressed by any public agency. Not AQMD, which I sit on the board of the committee that's the health study committee, that they've received $1 million in the litigation with Sempra, or Southern California Gas, and suggested that we do the CBC study, was ignored. Okay, so we did it on our own. So I'm not sure much more I can tell you, except that the statistics that are starting to show are very significant and very concerning. And if someone doesn't look at this, we look back at our regulators, we're going to be on the wrong side of history. And these people are ill. So these issues need to be addressed, in my opinion.
So just as a question, are you saying that the county public health officer who's responsible for that spa is not responsive to you?
Well, it's not that he's not responded to me. It was that he responded to the community healthcare providers in a very negative way. by documenting in public letters that we are to ignore this. Look for other etiologies of the causations of their symptomatology. Do not do testing.
And the county supervisor for your area has been non-responsive?
I've met with the Dr. Cyrus Rangan and Angelo Bellomo one time prior to a press conference that I was going to give off after I got into the clinical studies to let the people know, being transparent, that they were sick because there was so much discord in the community about these people were secondary gain human beings that wanted just money on a settlement, so forth and so on. So when I was going to expose this, they called me on the phone in my office for a stat meeting, came to my office, talked to me and said, please don't do this, don't blacken our eyes in essence, and we can work together. So I took them on their word, sat down with them, I said, you need to be transparent with this community because they're angry with you. You have a letter here that tells them not to investigate. As a healthcare provider, it's very insulting. And by the way, during that same time frame, I got called to my front desk for a nurse. A nurse came to my office from the Department of Public Health, sat down with me in my office and told me to ignore what was going on. Well, first of all, no, not an egotistical man, but an RN shouldn't be telling an MD what to do in healthcare. Two, it was way inappropriate for her to be there. So to try and guide us off the path of doing the right thing is the wrong thing. So all of that said, did I address your question? I apologize.
So far. The other question was city council member for the...
Smith. It'd be Mr. Smith at the moment because it was in Englander's district. Now Smith is filling out the balance of his term.
Have you met with either former council member Englander or Smith currently?
I have not. I've not been reached out to by anyone despite giving a town hall in front of 450 people and every news media there. Why, I'm not sure. So, back to one point, I apologize and I didn't mean to interrupt you, but back to the point of sitting down and meeting with Department of Public Health, when they told myself in a 3-person meeting, do not do that. I walked out, gave the press conference, and somebody asked me point blank about the representation or I'm having a stroke here, but the relationship between us. I said, fine. I did not blacken their eye. I did not badmouth them, no defamation or whatever. And I said, we need to try and work together. From that point, no communication. Why? No communication from the Department of Public Health. From DWP. Why? Because these issues are getting swept under the rug while the North San Fernando Valley is still sick today. Still having symptomatology, and the studies that are coming out that we're working on with Berkeley and Keck, very, very shocking. Not ready to be published yet, not ready to go public. And back to your question, which I just remembered you asked me, am I receiving any money for this? The answer is no. I've received not one dime. In fact, I've paid out of pocket to go investigate labs out of the state of California because we were so tainted in the science because of the politics. And if we mix these two up, we will never get at the question of what is going on and why people continue to make statements that this has no long-term health effect.
So I appreciate your efforts to try to help the community. But the question I had in regards to financing, whether you were being paid for it, obviously research studies cost money. Where's the financing? You're personally self-financing, or has the community given you funding to pay for the lab testing, et cetera?
The community has taken that cost on themselves, and they also did a GoFundMe page, which people donated so we could get the controls completed. Personally, nothing. I've received nothing, and I am not retained by any of the attorneys whether it be plaintiff or defendant. So there is no tainting here. I'm not sure if I could say that within regards to the AQMD, OEA, or the Department of Public Health. And they all report to the CPUC, which is in control of shutting this down. And by the way, just to let you know, another piece of information, a wind study was performed by 3 parties, and a wind study looked at that area during the shutdown phase. The shutdown phase was post the cementing or the plugging of the well till the recharging. That time frame was February 18th, 2016 to July 31st, 2017. A wind study was performed in that time frame by 3 institutions, UCLA Health, UC Berkeley, and Cambridge. They came out with their data. It went into the Department of Public Health. Department of Public Health, it was requested time after time after time. I sit on the committee with AQMD. Sat across the table and I said, we have a wind study. Where is it? They were part of it. AQMD was part of this wind study, but no one knew where it was. They sequestered that report for 2 years.
Can I just ask, did any of those 3 universities that conducted studies publish anything regarding that?
Nothing has been published.
So all of their data and findings, as far as you know, went to Department of Public Health?
Correct. In a study that I then asked through a Public Records Request Act for it to be turned over. The plaintiff attorneys filed a subpoena against the Public Health. Wouldn't turn it over. Until one gentleman behind closed doors received the study. And I was told on the phone,
received what?
one gentleman from Porter Ranch Neighborhood Council was given the study behind closed doors, and it became public. Upon it becoming public, I was told on the telephone that it wasn't completed. Said, you've had this for 2 years. How can it not be completed? So, in that study, the most important thing is in the downtime when that field was not charged to its capacity. There was evidence of fugitive admissions that are happening today. People are still getting exposed. Fugitive admissions when the field was not being used. So what does that mean now that it's charged? Those fugitive admissions are higher.
Thank you so much, Dr. Nordella.
You're welcome.
Nordella, I want to make sure your
It's
name
Nordella, yes, not Nord. It's Della,
Okay.
not just Ella.
If I can make a request, you've made strong allegations against several individuals or agencies, including used the term "they" multiple times. If you would be kind enough to either write a letter or an email to the city clerk to be given to us, so we would know who these individuals are, or when you use the term "they," it's a kind of nebulous term. They meaning the entire County of Los Angeles administration, they meaning the Department of Public Health. Who are you referring to when you say they? If you could just notify us, please, of who you've spoken to over this period of time and who is not responding to you. Potentially we could help you.
Well, we're working on that, and actually I think what we're waiting for is it to come out in a town hall when we do the release of all of the new stats that are coming in on the CBC. Because the people, to me, are who it should go to as well. So it's all about transparency, and as a physician, it's my job.
Thank you so much.
You're welcome.
Okay, next comment, Adam Cohen.
Good evening. My name is Adam Cohen. I work for AIDS Healthcare Foundation. I don't want to comment specifically about the details within this item. However, I do want to say that it's great that the City Council has asked the Health Commission to participate on a health-related topic, and I hope that you do take it seriously, and I do hope that there are more of these in the future. The collaborative efforts with the County Department of Public Health, it seems, and just any future opportunities for the Health Commission to expand its purpose to both hold the county and the city accountable and make sure that any health-related topics are shared with the community. Thank you.
Thank you. Okay. Next, we have Deirdre Bologna.
Good evening. Now, my name's Deirdre Bologna. I'm a resident of Porter Ranch, and I'm going to read my statement because I will get emotional and go on. So I want to get as much out in a little bit of time. But first of all, you all should have been emailed today a statement from one of the members of our organization, the ACCAC, the Aliso Canyon Community Action Committee. We sent, Patty Gluck was the one that would have sent you something that has stated all the facts, all our concerns. So let me begin. I am with the ACCAC. We have come together to be able to take an active role in decisions to ensure the highest attainable standard of health for all people in ours and other communities surrounding our community suffering with the aftermath of illness and disease after the largest methane blowout in the history of the United States. Our Board of Supervisors, Kathleen Barger, has not lifted a finger and refuses to meet with us to talk about our concerns. Also, LA County Health has not supported us in any way. You can even see that Greg Smith isn't here, our councilman. I know he's an intern, but this is a huge event that has happened, the biggest in the United States methane leak ever. He's not here. Nobody has come to our help, all right? Okay, I want the City Health Commission to know our community respects, trusts, and supports Dr. Nordella. We are forever grateful that Dr. Nordella exposed the true nature of health issues associated with the release of these cancer-causing toxins that spewed and continue to leak every day. We have that under court record. And I want to make clear that we have zero trust in LA County Department of Health. They have misled us and our courageous first responders that were put in harm's way with personal meetings and insurances that and boilerplate statements released from SoCalGas, approved by LA County Health, that the exposure to these toxicants have not put us or our community in any harm. We don't trust them. We don't want them involved in the health study. We trust Dr. Nordella. He's the only one that's come to help our community, and we are forever grateful. Thank you.
Thank you for your testimony.
Next, Lori, and I apologize if I mispronounced, Lori Ivasian.
You did pretty well there. It's Lori Avazian.
Oh, okay.
Thank you for the opportunity to speak to the commission this evening. I need to read from a written as well because I get nervous. I'm a 19-year resident of Porter Ranch. My home is located 1.5 miles away from the well SS-25, which blew out at Aliso Canyon. It caused my family and our pets to suffer terrible health effects such as migraine headaches, respiratory problems, skin rashes, bloody noses, hair loss, gastrointestinal problems from the bombardment of chemicals we were exposed to. We had to evacuate from our home for 5 months 3 years ago. It's now been 3 years since the blowout well was capped. My family and my community continue to suffer from ill health effects from the chemicals we were exposed to and are still being exposed to. My daughter, who's away at college, still suffers from nosebleeds, rashes, and headaches whenever she returns home. I've lost a once healthy cat that was only 7 years old, and a 10-year-old Labrador have both died. They both suffered terrible problems and were at the vet constantly during and after the blowout. I still get migraines, rashes, and now have to use an asthma inhaler, which I never did before, whenever the levels of chemicals are high. I can tell you pretty much when there are releases because of the way I feel. 5 of my daughters school teachers at Castle Bay Elementary, which is located less than a mile down the hill from the facility, have died of cancers often caused by chemical exposure. I don't think anyone knows of a school where 5 of their children's elementary school teachers have died of cancer. I'm very disappointed that it's now 3 years and counting since we were bombarded with a dangerous soup of chemicals, and to this day, not one blood test, not one questionnaire, or anything involving the health effects of the blowout has been performed by the city, the county, or state agency on any one of us who is affected. Dr. Jeffrey Nordella seems to be the only physician who's actively trying to help our community. Can I go on a bit longer?
Yes, please.
The AQMD came to a $1 million settlement with SCG. When County Health had worked with them and determined with a panel that $25 to $30 million was required to do a proper health study on the effects of the blowout on the surrounding community. They've decided to use that $1 million on a wind study of the area surrounding the Aliso Canyon facility. This seems a very foolish way to spend this $1 million since UCLA and Public Health have already performed this very study 3 years ago. I've read bits and pieces of it. It's very long, but got it when it was sent to our neighborhood council president. I am also a member of the Aliso Canyon Community Action Committee, which many of my fellow residents who are here this evening, who stayed very active and informed regarding this disaster, formed. We represent the impacted community, and we'd like to work in good faith with county and city elected officials to develop an independent, objective, and science-based health study plan with the $25 million that's been allotted for a health study in the settlement that the city, the county, and the state made with SoCalGas. We hope this will meet the health and safety needs of our community. We ask for the help of this commission, and again, we do appreciate you hearing us this evening and doing the right thing by our community, which has been so terribly impacted and continues to be impacted by the Aliso Canyon Natural Gas Storage Facility. Thank you.
Thank you.
Thank you.
Next is, I believe this says Helen. I'm not quite sure. Okay. Hello.
Hello, my name is Helen Atai. I'm a resident of Granada Hills for 28 years. I am another affected resident. My family and I have been sick and still suffering because of the blowout we had more than 3 years ago. We were relocated, just like my friend, 5 months from my home, living in hotels. It was awful, and still that place is leaking and making us sick. When I took my daughter when I had to rush her to hospital when she was vomiting so violently for no reason, she had stomach problem, I went to Holy Cross. Emergency room was almost full of patients, the same symptom. They had to close down the trauma center, the Holy Cross emergency room, because it was full because of all the people like that. And when I asked the doctor, please run a test on my daughter, blood work, to see what's going on, what's making her sick. And he said, well, you showed me the letter from the Department of Health that they're not allowed to do testing on these patients. The letter was issued by Dr. Rangan, says do not test these people, and just, if they're making noise, refer them to me, Dr. Rangan, personally. And he never answers the phones anyways. So there's a big cover-up going on in our area. And I'm so glad to see you guys are getting involved, because honestly, more than 3.5 years, we have been dealing with Department of Health. We have been trying to have a meeting with the Barger's office. We have been ignored. As big as the problem is, I don't understand why nobody is getting involved. This is happening in the city of LA. And I am so glad you told me that today that you guys are gatekeepers, and I really hope you guys get involved, because this is ridiculous what's going on and what's happening in our city, in our state, and in this country. Thank you.
Thank
Thank
you.
you.
I have a question for all of you who are represented through this organization. Have you spoken to the city administrator who's in charge of petroleum and gas?
No.
His name is Udak Joe Nutuk. I mean, he is the chief administrator who's responsible for all issues that are either directly or indirectly related to petroleum or natural gas.
And what other issue?
I can speak for myself, and I think I can speak for the other commissioners, that we as a commission, individually or as a group, will try to help you in any way that we can, given the limits of our power.
We appreciate it, but the strange thing is about the meeting tonight, we just find out last night by accident. If this is regarding our community, why is it that our community wasn't notified about this meeting? And why is it that Department of Health is not here? And why is it that you guys are not coming to our area so more people could attend? It took us an hour and a half to get here, Monday night. And people, we all have busy lives and works and all that. We had to get off early from work and just rush here. And, it would be very nice if you guys could come to our community, or we could have face-to-face, just sit down. Feeling I got tonight that you guys are not aware of exactly what's going on in our area, and it would be nice if you all could sit down and just talk to each other and communicate for you guys to be aware of what's going on. And I'm really, really hoping that you guys get involved.
Thank you. Thank you so much. Craig Galanti.
Thank you for allowing us to speak tonight on this very important issue. I have a whole page here, and I'm kind of going to abandon it because what I'm absolutely noticing here is there's a health crisis, and this fits in with what you guys are here to talk about tonight. And it's a health crisis that is probably the best kept secret in the city of Los Angeles and the county of Los Angeles, and we must ask ourselves why. Thank God for this gentleman back here, Dr. Jeffrey Nordella, because he fulfilled his oath, do no harm, take care of people. Okay? There's no other way to describe his motivation. Yet, he did the very simple things of looking at symptomatology, following his training. The community kicks in and spends their own money to participate in blood tests. He doesn't take a dime. And he's exposing something here, ladies and gentlemen, that needs to be addressed. Englander, CD12 councilman, who is no longer on board, and Greg Smith, who's not even here this evening, should be carrying this ball for his constituents. A very simple question was posed in what you're supposed to be discussing tonight, right? It's very simple. A physician who is very credentialed, very credible, said, I'm finding benzene levels, styrene, and other toxins in people that live in this community. Where's the urgency, folks? Where's the call to action? Where are the agencies and the regulators that are supposed to be protecting us? This could happen in your district. Set the example of how the city of Los Angeles defends its people and works with the County of Public Health. We have worked with the County of Public Health. I should give you some context. May I continue?
Yes.
I'll be concise if possible. We were so frustrated that there was no proper addressing of these issues, that many of us in this room started our own Aliso Canyon Community Action Committee. Why? Because no one else was looking out for us. And we partner with as many people in the community and neighborhood councils, but the fact that public health is not even here to answer a simple question that a councilman put forward to help protect his constituents. I mean, I felt a little embarrassed for you guys, and I don't think it's necessarily anyone's fault in this room. You didn't even know what you were here to discuss. So, you know, I walked in angry, and then I was like, you felt that frustration where you're all kind of looking at each other and going, what are we supposed to be reviewing? What am I supposed to add value to? You don't know. Why is that? This is the Health Commission of LA City. This happened in your city. This happened on your watch. Where is the urgency? We took it upon ourselves to create this action committee. We are the voice of the community. We want to partner with city and county officials, elected officials, to get to the best solution in a health study that is scientifically based and 100% independent. In order to do that, we reject county public health to be steering that ship. We reject the notion that they are operating with pure agendas, or else they would be here tonight and they would be all involved. This committee represents the community that's been hurt, and we want to have meetings. You want to help us? We have not met with our supervisor. Kathleen Barger has ignored numerous requests to have a meeting regarding this urgent matter. How is that possible? This is the largest multi-toxin exposure in U.S. history. This is Chernobyl. This is Flint. And it's 3.5 years later, and you guys may be aware of it on the peripheral, but not deeply embedded in what the issues are. This could happen in your districts. Stand up. Join us. We are not going to sit idly by, nor should we. Our health, our family's health is at stake. Benzene is a carcinogen, a very serious one, and is proliferating out of that field, unabated. We have documentation that shows that. Where is the call to action? Where is the urgency? And it's difficult not to get upset. I'll be happy to answer any questions you have.
Thank you. Nancy Hernandez.
Not Nancy, but I just want to tell you one thing that is very important that I didn't tell you earlier.
Sorry.
Madam President, the speaker's already
sorry.
spoken. Thank you.
Nancy Hernandez.
I'm not prepared, but you guys weren't either, so I don't feel so bad. And just want to say that Dr. Nordella is our hero. He's been the only one there for us from the moment this disaster started. Dr. Rangan sent out the letter. First of all, I'd like to even know, have you guys seen the letter that he sent out to our doctors, to our pediatricians, telling them not to perform toxicology testing? This was 2016, I believe, March, is that right? 2016. I didn't listen. I went out of state and I had a toxicology test done on my son. He tested an 89th percentile of benzene. I went to a meeting which was held by Department of Public Health after they did the heavy metals testing in the homes. They selected 100 homes in Porter Ranch, tested for heavy metals, found 6 that were above average limits. Okay, so I waited for Dr. Rangan after his presentation, walked up to him, took him my son's toxicology results, and he knew exactly who I was because my pediatrician had contacted him. He told my pediatrician that those numbers cannot be measured, that there's nothing to compare to. Basically, there's nothing that can be done. So I spoke to him, and as soon as he saw the results, he said, those numbers mean nothing. What do you mean they mean nothing? They don't mean anything. I said, okay, what would you do if it was your own child that resulted with these numbers? He said, nothing. I would do nothing. Okay, well, you guys have found now 6 metals in all these homes, right? You just presented it today. What about heavy metals testing for my son? He said, it's not worth it. It's just a waste of time. Dr. Cyrus Rangan is the head toxicologist for Department of Public Health. Shame on him. I'm curious to know if you guys, and I don't know if I can even ask, but did you learn something from everyone that spoke today? Did you hear anything that you didn't already know? If you knew, then shame on you too.
Thank you.
So point of clarification to you all, you should know this is a voluntary commission. We're not paid by the city. We're volunteers like the doctor who did work for you. We are a commission that has been set up to attempt to assist the city of Los Angeles. The city of Los Angeles doesn't really have a jurisdiction over public health in the county of Los Angeles or within its own area of the city. The county has primary jurisdiction on that. So we're never notified of any of the information that you're presenting to us. This is the first time when we were given this dictum from the city council to look into it. So as of yesterday, we have not been notified at all of any data, any information. There is a city administrator who has authority over gas and petroleum. We will speak to him and we'll ask what is being done from the city side. But you should be aware that the reason we're looking clueless is we have not been given any information, nor has that been an area where we have been asked to look into by the city before. So we can only do what we're asked to do or what comes up through public information as you're presenting to us today. So we appreciate your time and your effort. We appreciate the fact that you came to the City Hall to testify. You're educating us. We'll do our due diligence and we'll attempt to help you in any way we can through the proper channels as limited by the law and the rules of the city and the chart of the city.
Perfect. Okay, so we have one more public comment. Pepita.
So you see what you've done. You have brought the white people here today, all the way from the North Valley, yes, to come down to you cocksuckers to speak. Now, every day, me and my friend look at the goddamn agenda. We didn't see this meeting until today. It wasn't there Friday or Saturday. You hid the meeting on purpose to keep these people away.
Please stay on topic. Thank you.
You never, in one time, did she ever interrupt them?
Not a goddamn time.
She even lets them talk from the audience. Why? Because this bitch understands what we are. We are the victims of the Aliso Canyon. I drove with my friend 2 weeks ago. You can smell it in the air before you cross the 118 bridge. Whenever those things leak, they're leaking again. And it's spewing chemicals into the 405 area. outside of the LA City area in the unincorporated area of CD5, known as the 5th Council District. It's right. And you're covering it up. Me and Mr. Herman came here 2 years ago and started talking about this shit, so you know about it. You know everything. You've been given the emails. Mitchell Englander is currently a rat for the FBI, and Mr. Smith is his eyes. So don't give us this shit. You know what happened. You know these people were poisoned. Now what are you going to do? Nothing. You're going to sit there and look at your phones and go, I hope this meeting ends soon. I hope I get out of here in time to go get my McDonald's Happy Meal. Well, take your Happy Meal and stick it down your pipes, you criminals.
Item number 3, update on Los Angeles City Health Commission report.
I'm just trying to figure out if there is anything at this juncture that we can do.
Yeah.
Responsive, and I'm not 100% sure how to phrase it, but it is certainly an issue of importance, and I'm trying to figure out what we do.
Absolutely. So Commissioner Mandel has some great ideas about next steps, so that's kind of pretty much what I was going to employ. Wait a minute, where did I go with my next steps? I wrote them all down. They're here.
We don't have any data to make it.
Right.
We don't know what our authority is in regards to this issue, and nor do we know what the county has done. If there has been investigations, we need to find out what was done.
Right.
So clearly the city administrator in petroleum gas needs to let us know what the city is doing from the city side.
All right, so
And then from the county side, we need to find out what.
Following up at the next meeting with the city's
Right.
oil and gas administrator, or whatever that's.
As well as the county Department of Public Health.
Could we make an inquiry of the health department?
Sure.
Yes. Yes.
Sure. And we should.
That's part of our next steps, and even not waiting until the next meeting in the interim,
And,
asking for the data.
Correct me, the congressional district that you all are in, did that just change hands? Were you and Steve Knights, and now it's Ms. Hill?
Correct.
Has she expressed any interest in it?
Very much so.
Okay,
Very
so
much so. She would
so
like
that
to see
might
this field shut down.
stimulate some
Commissioner
action,
Hisserich?
at least from her office.
Commissioner Hisserich.
That might stimulate some interest from the congressional office.
Very interested, sir.
All right.
Very interested, sir, but this becomes a county and state issue.
Has
We
any
need your
member
help.
of Supervisor Barger's office
No,
been in
we've
touch?
tried repeatedly.
Commissioner
sir.
Hisserich?
This is really important. I'll be brief.
We can't have
Oh, okay.
cross conversation, but he's already given his statement during
okay.
public comment.
Trying to find
Thank
out
you.
what we can do.
Yeah. All right, item number 3, update on Los Angeles City Health Commission report. So I just wanted to give a brief update that as you know, the report has been completed, and that I've been working with Candy to make sure it gets out to the council. So we've been working on the wording for that as well. So that was all I really wanted to say about the commission report, that we have taken it, we have put together our little recommendation talking points, and getting ready to send it out to the council members. So following up with her on that. So that was all that I wanted to say about that. We have 2 comments for item 3. Adam Cohen.
My name is Adam Cohen from AIDS Healthcare Foundation. I'm assuming that last month's report is the final version, and just to make sure I also clarified, it was a little loud back there, that you have talking points that you're putting together that will be shared with the City Council. Hopefully, and I'm hoping that they schedule time for you to present this at a City Council event. I think that's part of the requirement, but they must invite you, I believe. But I hope that if they don't, because they might, that you at least go and just speak during public comments at a City Council meeting and share the report with the City Council members, because it seems like what happened last time might happen this time, and I would really like that not to be the case. Thank you.
Thank you. Pepita.
so yes, we want to have you appear before the council. Go and look Herb Wesson in the eye and tell him he's a crook, and tell him also that you know that his wife has a job at the AQMD making $200,000 a year to do absolutely fucking nothing. Her name is Fabian Wesson, yes. Now, why is the wife of Councilman Herb Wesson working for AQMD? Help cover up Aliso Canyon. Look at when she became her job employment, 2017. So we are the legislative body. We are exposing you. We are the ones who brought the FBI here. You need to clean this shit up, FBI, wherever you are. Indict the entire council and shove a banana up their assholes.
Thank you. Item number 4, update on Los Angeles City Health Commission vacancies. So there has been quite a bit of action with the empty vacant seats on the commission. I'm happy to report that we do have a commissioner for Council District 13. We are waiting for an official letter for him to join, and that commissioner is Matt Crane, our commission intern. He has been appointed for Council District 13. I got word from our clerk that Council District 7 also is appointing, and they will be sending us a letter. So I don't have a name, but they will be appointed soon. And I reached out to Council District 10 to let them know, hey, we have not seen our commissioners for some time, and they would be following up. So I will also be following up with Council District 10. So we will have 2 new commissioners, and we are making our way in filling our vacancies. Okay? So thank you.
CD 12 has it, right?
No. I can follow up with them too. CD 12. Okay. All right. We have 2 comments for item 4. I believe these are 1 minute each. Adam Cohen, 1 minute.
Just to clarify, first of all, I think that's great that Mr. Crane will be joining as a commission member. That's delightful to hear. I believe the 5 initial districts, well, 4 now, excluding 13, were 3, 6, 7, and 12. I think you mentioned 10. I'm not sure if maybe I got that wrong, but hopefully we'll at least still be able to fill districts 3 with Blumenfield, district 6 with Martinez, 7 with Monica Rodriguez, and the other 2, I suppose, have been filled. So thank you for pushing for that. I hope you continue to push for the remaining districts to fill this, because it is important to have all 15 members, which can then add numbers of representation of the different areas of Los Angeles. Thank you.
Thank you.
That's good.
We appreciate that.
You have met your time quota, sir.
What's that?
You get a total of 5 per commission meeting. You've done 2, 2, and 1. That's 5. I'm sorry? The commission rule is very clear that we allow 5 minutes max per.
Okay. So we're going to move on to item number 5. We're closing comments for item number 4.
We appreciate you coming.
Discriminatory beach. Now I
So
will file a
moving on
claim
to
for
items for
damages.
future discussion.
You let all those other people talk from the.
You've talked for 5 minutes. We appreciate you coming in.
Madam Speaker, the speaker's allotted time had expired. If the commission
We're
wants.
moving on. Thank you. Item number 5, items for future discussion. Any conversations about future discussion items?
Well, I mean, I think we should follow up on what we were just talking about.
Right.
I think that'll take up a lot of time for the next meeting or 2 or 3 meetings.
Perfect. Okay. Any other thoughts? I think that's Commissioner Estrada?
Future agenda items, I had requested if we could please get a report on the rodent infestation at
Okay.
City Hall. Corrective actions that have been taken and what the status is.
Okay. Any other items? I think that sounds pretty good. Okay. Okay. Okay, ready to adjourn?
I'll move to adjourn.
Okay, second? All right, all in favor?
Aye.
Any opposition to adjourning? The meeting is adjourned. I will see you next month. Thank you.